Greetings and welcome to College Planning with the National Alliance for the Advancement of Haitian Professionals. I'm Dr. Ketsia Alert Sadler, founder of College Cafe and your moderator for this webinar series. We'd like to welcome you all for our latest episode with a topic that is near and dear to my heart because I deal with it every day. So very excited to have these ladies join me. But first, before we start, we want to thank our partners, starting, of course, with the National Alliance for the Advancement of Haitian Professionals. We have Golden V, and we also have Parent Matters, and finally, College Cafe. So thank you so much for joining us with this topic of careers in nursing, more than just bedside. So tonight, we're going to delve into the topic of the people that you see when you are admitted as a patient or when you go see a family member in the hospital, but we're going to talk about a little bit more because, as we said, we're not just dealing with you in the hospital. So my first guest this evening is Miss Amber Pearson. She is one of the newest of the group to join the profession. She is a neonatal nurse in a local hospital nearby. And we also have Miss Lisa Vialva, MSN, who is a pediatric nurse practitioner. And she's from down south where she works with pediatrics and also subspecialty in primary care. Our third guest this evening is Dr. Maryelena Vargas, PhD, as opposed to an EDD. And she also has had 18 plus years of experience as a nurse educator. She's taught graduate nursing and public health courses at Weill Cornell, Ramapo, and Fairleigh Dickinson in New Jersey. And our last guest who will join us later is Miss Mona Lisa Abankwa RN, who is also a board certified family nurse practitioner. And yours truly, who is a school nurse who has close to 30 years now as 30 years of nursing, about 17 years bedside, and this is my 23rd year as a school nurse. So very excited, ladies. Thank you for joining us and to share your experience and your life as a nurse. So my first question is, and you could be brief about it because we're going to talk more about our education. Just tell me, was nursing your first career choice or was it not? And if not, what did you want to be when you grew up? So we'll start with you, Amber.
Sure. Good evening, everyone. So nursing was not my first career choice. I actually have a bachelor's degree in psychology where I also minored in sociology and criminal justice. So I originally wanted to pursue the psychiatric route, whether that be psychiatrist, social work, but I began, being exposed to nurses while working in the emergency room as a mental health worker. So this is my second career choice and I am loving it thus far.
Thank you. Ms. Vialva. I think we lost Lisa. Okay. Dr. Vargas, we'll go to you and hopefully Lisa will join back in.
It was not my first choice, same as with Amber. It was a very funny way that I fell into nursing. My friend took the exam to enter a program in nursing. I happened to be with my friend, and the dean of the school thought I was taking the exam. She gave me the exam. I took it and I passed it, and she's like, "Welcome to nursing." I'm like, "Oh, okay, I'm going to nursing," because I didn't know what I was doing.
Got it. Yeah. All right. Lisa, as we start off with our first question as to whether nursing was your first career, and if not, what did you want to do instead or first?
So first, thank you, Ketsia, for having me on here. It actually was not my first career choice. I actually wanted to become a doctor. So I've always had medical in my forefront. However, my journey took a couple of detours, and here I am as a nurse practitioner.
Okay. So your story's kind of like mine as well, because I planned to go to college, major in biology, and go on to medical school as a pediatric cardiologist. That didn't happen. And then so I credit my husband for meeting him a couple years after I got out of school. And he said, well, why don't you go to nursing school? That still keeps you in the medical career. And I was like, oh, okay. And so here we are 30 years later. And I think it was probably the best thing I could have done because I'm still working with children, and cardiac is still my love out of all the systems in the body. So I feel like I'm still doing what I was meant to do, but in a different way. So thank you, ladies, for sharing that. So Miss Pearson, you started talking about your academic career. So if everyone could share exactly, if you want to go into more as far as what your majors were in college, or what your bachelor's degrees were in prior to going to nursing school. We'll start with you, Dr. Vargas.
Sure. Oh, no problem.
Great. So actually, I finished my associate's degree in nursing, right? And then I went for my bachelor's in nursing. I studied in the community college because I couldn't really afford to go to a 4-year college. So I went to the associate's degree. Once I had my associate's degree, I was able to work during the week, and I was able to go to school to finish my bachelor's during the weekend. So I found a program that I was able to go once a week and finish my bachelor's degree in nursing.
That's cool.
Mm-hmm.
Nurse Vialva, your turn.
So similar to Dr. Vargas, when I came to this country, I took a course as a medical assistant, and I was a medical assistant for 13 plus years. I already knew, I kind of at that time kind of pivoted towards nursing school. However, I needed to be able to work. I was unable to work part-time and go to school full-time. So I needed to work full-time. So I finally found a 2-year college. So I can go to school at night full-time and work full-time. And so I went to community college, got my associate's degree. When I moved down to Georgia in 2016, I decided to go back to get my bachelor's. I did that online while working in pediatric cardiology. And I got my bachelor's, and then I went to grad school. So everything I did took time. There was a course that I needed to take. I don't regret any steps that I took, because that's the journey I did that I needed to take. And one of my passions is actually pediatric cardiology. It's one of my subspecialties.
Nice. Okay, Ms. Pearson.
I did actually start off at a community college, which I didn't state before. So I originally started off at Bergen Community College right here in Jersey. I got my associate's degree in psychology, transferred to Rutgers Newark, and most of my classes were in not the non-sciences, of course. So when I originally had to go back, and even before I started the ABSN program, I had to take all of my prerequisites. So that's where I really got a chance to be exposed to the sciences. So then I moved forward with my second bachelor's degree in nursing.
Okay. So for those who are listening, you're hearing that some of our nurse panelists this evening started at the community college level. And as you see, I'm pretty sure that when you're working with your patients, no one is asking you if you went to a community college first. The question is, I'm having pain. Can you assess me properly to figure out, do I need to call a doctor or whatever? So I'm just saying that to everyone who is out there, who's listening, who feels that that's not a good place to start, is definitely a great place to start, finance-wise, support-wise, academically, because you can go on further to continue your education. For me, like I said, I started in a bachelor's program intending to go on to med school. And then when I applied for nursing school, I was accepted into Holy Name Nursing School and then also into Felician. And Felician at the time told me that I needed to take some prerequisite courses before they would admit me into their bachelor's program. And Holy Name said, we'll take you right away. And I said, I'm going to Holy Name. I don't have time. I'm married with a child. I do not have time to try to play around and see if I'm going to get in. And I'm quite happy I went to Holy Name. The training was great. By the time I started working, I was totally comfortable with being on a nurse's unit. I worked as a nursing assistant as well at the hospital. So the nurses were really cool, taking us under their wing to say, oh, come watch this procedure or whatever. So it was really great to learn. So let's talk about the coursework in nursing. So how did you all find it? What were some of the challenges, struggles? What came easy? Sometimes something comes easy. So Ms. Nurse Vialva, you want to start off?
So what I actually found challenging, so the prerequisites were fine. once you kind of got into your specialties, whether it's maternity, whether it's pediatrics, whether it's GIGU, whether it's cardiac, because I already had a foundation. So when I was in nursing school, I was actually working at a place, Tenafly Pediatrics in Clifton, New Jersey. And so I was already in pediatrics. I barely passed the pediatric course. And I think it's because I jumped ahead of the game because I already kind of knew, and I had to almost pull myself back. So that was a struggle when you're already in the medical field and doing nursing. It can be challenging because you're not starting from a clean slate. Sometimes a clean slate or a blank slate is much easier because you don't have that knowledge base from jump. And so when you're already in the medical field, you're like, okay, yeah, I know this, but nurses, the courses, they expect you to pull back to the basics as if you did not know. So that was one of the main challenges that I had when I was taking my classes.
Okay. Nurse Pearson?
For me, I would definitely say finding which study style works for you, especially it being that I was in an accelerated program. It's fast-paced, so you have to allocate enough time to each course. Pharmacology was a big struggle for me, learning those medications. But if you find out, where is your struggle class versus where's the class that's less challenging for you, you can then kind of deviate the amount of hours and time. So with my first degree in psychology, I really didn't have to spend as many hours within the library, whereas with nursing and the accelerated program, you kind of see, okay, I do have to dedicate that time. And so definitely a big change within these two degrees for sure.
Okay. Dr. Vargas?
With me, I went to Bergen for my associates, Bergen Community College, and they must have prepared me really well because I remember I really studied a lot for that degree, and I thought, oh no, college education may not be for me. It's hard. And then I went on to Fairleigh Dickinson University to get my bachelor's. And I found it so easy. And I always thought back to Bergen Community College, wow, they prepared me really well. Because honestly, my bachelor's was really easy. They made it easy for me. They took a lot of the credits, and it was more like a conversational seminar type of setting. So the classes were very enjoyable, and I was very happy when I got my bachelor's. And I have to tell you, it was easy. After the associates at Bergen, bachelor's was easy.
Okay. So did you do an accelerated program, or were you just?
No, what I did is RN to BSN.
Okay.
There was a program at Fairleigh Dickinson. We still have it. And it's RN to BSN. So they look at the credits. I came in with a lot of credits from Bergen Community College. They took 60 of those.
Right.
And then I was able to complete those courses that I didn't have at Bergen, community health, nursing, economics, those high-level baccalaureate type of courses at FDU. And they FDU made it easy for me to get that degree.
Okay. That's quite helpful when you're able to transfer so many credits in, because then you can focus obviously on the classes you need. For me as well, I felt that going into the RN program, I didn't find the work difficult. What was more difficult was the time management, because as I said, I was a new wife with a 1-year-old, so trying to manage a household and study. And then for me, my learning style was I'm a combination of auditory and visual. So I remember coming home at night and rewriting all my notes after I listened in school. I would come home, rewrite them. I had like different color-coded pens to be able to reiterate things. And then also every night I would read over my notes, not so much to memorize, but to be familiar with the work, so that once I got to the test, or when it was close to study, then I would, focus on whatever information I didn't know. And what I liked about Holy Name with our training was that a month into school, they had us already in skills labs. So you're learning how to do bed baths and all those skills, basic skills that you would need when you're on the floor. So seeing where you are now in your careers, would you go back? Would you pick nursing again? Or would you do the pathway differently? Oh, anybody could jump in on that one.
Okay. So let me jump in really quick because I think that's so much like me. I would definitely go back and choose nursing. Nursing to me was an accident. I told you how I fell into nursing. And I would definitely go back now and choose nursing. I'm a pediatric nurse practitioner, family nurse practitioner, and professor. And when I work as a family nurse practitioner with my colleagues, my physician colleagues, somehow I feel that the work of being a nurse, it's, in my opinion, is more fulfilling to me just because I can, with nursing, is so flexible. I can do anything. I can go into public health, which I did. I can go into home care, which I did. I can go into critical care, which I did. I went into community health nursing, I did. Teaching, I did. So anything that I wanted to do, nursing was so flexible and interesting that I would definitely go back and choose nursing.
Okay. Anyone else can jump in now.
So sure. Oh, you go.
Like Dr. Vargas, I too, I don't think I would change the path that I've reached. I feel there was a reason why I'm on this path. My passion has always been to help others. And I've always wanted, I don't know what it was, but I've always wanted to do that. That's just me in nature. And I don't think I would change it. And I think even though my passion started out as being a physician, I feel being a nurse and then as a nurse practitioner, we have that background of being a nurse and having that, even that bedside, that added plus to what we can do and bring to patients, that almost hand-holding effect, that how can we help? How can we be of service? And I feel that's I think one of the biggest things that I will always take home with me. And I probably would repeat it again, this journey and this path that I took.
Mm-hmm. Nurse Amber?
I definitely would have gone back. Maybe not have done things too differently. I still, enjoyed my time getting my degree in psychology, but considering I spent almost a year taking those prerequisite courses for nursing school, I would have gone back and probably received nursing as my first degree.
Mm-hmm. Yeah, I think I would too. With me, what was interesting is when I started working as a bedside nurse, I knew that was not for me. And I knew I didn't want to stay in the hospital setting. So I was trying to figure out what can I do with my bachelor's in biology, my RN diploma, but still be effective and helping children. And so I realized school nursing was a very good place to be, because for me, I wanted to be more on the proactive end of health as opposed to reactive, which is what I feel sometimes bedside is. You're sick and now you're diagnosed, let's try to help you. Whereas with kids, we're talking about healthy lifestyles. Like at school, this year I finally started a health club with the kids, and we're talking about making healthier food choices, lifestyle choices, exercises. So that's kind of like where my passion has gone. So I feel like that's what I would have gone towards and stayed in the nursing path, definitely. So any other areas you ladies think you'd want to explore in nursing? I know Dr. Vargas, you've had your hand in a few different ones before Nurse Vialva and Nurse Pearson. Anything else? Any other areas? And Dr. Vargas too, what other areas of nursing would you want to do? Anybody could jump in.
So actually the one end of nursing that I'm actually dabbling in a little bit and seeing where it takes me. So being on the primary care end of things and actually working in pediatric cardiology outpatient. I've only worked outpatient. I have never done bedside, never worked in the hospital. which I'm fine with. I started nursing really late in life, and I didn't like the rotations, except for pediatrics, when I was doing my rotations. So I'm like, I'm not going to change anything. But the one thing that I have found that I actually combine pediatric cardiology and primary care together, I've noticed that there's a huge growth of childhood obesity in this country, and living down the South now, it's amplified, I would say. And so what I've actually started to implement where I work at Monroe Pediatrics in Monroe, Georgia, is I actually follow a lot of children for lifestyle management and modification. And basically, once I see them for their well care visits and I determine where they are with their BMIs and the risk factors that they have, I have almost like I'm actually trying to create an algorithm of I'm sending them for lab work. This is the next step I want to do. And instead of seeing them in 1 year, hey, I'll see you for another checkup, I'm seeing them in increments in 2 years, kind of following through. Let's see the changes that can be made. So, and I'm also on the preventative team in cardiology as well. So I get to toggle between the both of them, because when you have childhood obesity, you're also treating them for some high blood pressure. You're treating them with elevated cholesterol. So there are many things. So my goal is to really see what I can do on that platform to really expound upon it, because it's serious. It's really, really serious. Living in Bergen County, in New Jersey, I did not see it that prevalent. Coming down in the South, big eye opener about what it can do and potentially how it can affect them in the long run. And I follow children from as young as 7 years old. And I follow all of them, regardless of the age. But my youngest, I think maybe is 6 years old. But then we run into the problems of them having cardiac issues with the obesity happening. So that's one of the things that I'm exploring in, and hopefully make it into something bigger and more profitable in the long run.
No, the obesity epidemic is here. As I said, I'm a school nurse and I see it, every day. You see children who are a young age and their weight is, ridiculous. And part of it is, lifestyle. Somehow living in, believe it or not, in Bergen County can be a food desert in some places. You have too many fast food spots. Like I said, that's become my mission. And I'm trying to attack it in a way where it's fun. So for instance, one thing I've done in my building is making birthday parties a little bit healthier. So we've cut out the cake. We don't come and drop off cupcakes or a pizza party or whatever. There's a place in Ridgewood called Health Barn USA. So we've actually started taking the kids on trips there for your birthday. We're in the garden composting. You're seeing what basil looks like, what mint leaves are. They're doing yoga and making smoothies. We're celebrating your birthday, but we're talking about doing it in a healthier way, so you can start thinking about making healthier food choices. Unfortunately, the obesity epidemic is something that we have to, those in power, and this is my soapbox, so I'll have to stop real quick, but those in power who are creating the foods and putting these bad things out there need to really take a seat back and really understand how much of influence they have on the kids. It's just amazing. So thank you for that. Yes, ladies, you can share in on your plans or other things that you'd like to do in nursing. Dr. Vargas or Nurse Pearson?
Sure.
Go ahead.
Thank you. So I am a new grad nurse, so I've enjoyed my time in the NICU for these past 6 months, but I do hope, whether it's in the next few years or I can use my time working on my, psychiatric nursing experience, whether that be inpatient or outpatient. I do have some inpatient experience as a psychiatric technician. And when I originally started nursing school, I said I'm going to be a psychiatric nurse practitioner. And then I'm sure you ladies know you get exposed to so many different specialties. And that's where I found my love for neonatal nursing. So I have the opportunity to connect with mom and, provide that support. But at the same time, I do have it in the back of my head, maybe you should explore psychiatric nursing and see if that's something that is for you, since it was my original passion when starting nursing.
Got it.
With me, similarly, right now I am a family nurse practitioner. I work for North Hudson Community Action Corporation in the pediatric area, and I enjoy it very much because I have an opportunity to really impact kids and families long term. I see newborns that are coming in. I'm excited to teach them how to breastfeed, to correct the latch, to make sure that they're doing it correctly, that they're going to breastfeed those kids in order for them to be long-term healthy. The education with obesity epidemic, I'm with you. I'm always, looking at their BMI, educating them in nutritional requirements that they need to do activity, increase activity. We're living in a sedentary world with all these, electronic platforms. We're staying home, we're sitting in the couch. And what we need to do is be more active. Like when we were kids, we were always running around, climbing the trees, making, any games we used to make with anything. We used to play with anything. We make like a round ball, and we'll like kick it all day, and we'll like chase each other that way. So the activity, the differences in activity, we need to exercise, encourage the kids to walk, to exercise, to play, to go out there, to have friends, to have play dates, in a safe environment. But so I wouldn't do anything else at this stage in my life. I would stay as a professor. I would stay as a family nurse practitioner. I think I'm at a point in my life that I'm enjoying my careers very much. Yeah.
Awesome. So let's go also into talking about the different levels of nursing. So we have LPNs. You can start as an LPN, which is usually like an 18-month program, right? And then we have going to an associate's program for 2 years, or RN diploma program like I did. Or you can also go for your BSN right out the bat. So that's 4 years. And then as Amber did, you did the accelerated BSN program. And then you can go on, especially into the nurse practitioner. Can you talk a little bit about the nurse practitioner training, and how many years can that be, depending? And then how do you, is there a board exam that you have to take for the audience who might not know?
So I went to University of Alabama in Birmingham. I went to UAB, and it took me about, after I got my BSN, it took me about 2 years to get my graduate degree. It was intense. It was very intense. It was not, your life was on hold for 2 years, and I felt I had no wiggle room when I was in grad school. No wiggle room at all. Your exams were I had exams every 2 weeks. It was on Zoom, it was on this browser, and it was intense. And initially, everyone who was signed up in the grad program, they were in the same class. And then the beginning of the second year, you branched off into your subspecialties. So initially, everyone was taking the same courses. It was very, very stressful, but doable. You have to stay organized. Organization is very, very important in grad school. There's really not much wiggle room at all. And there is a board exam that you have to take, similar to the nursing, similar to when you took your nursing exam. However, the questions are different in the sense that we are now diagnosing, we are managing, we are assessing, and we can treat. So now it changes the format of the questions to a degree. Preparation for boards are intense. You do need to have a game plan. You have to be super organized in how you're studying, and know your resources that you're using. There are a lot of resources out there. And my take home is pick 2 or 3 of your resources and that's it. If not, you're going to get boggled down in so many resources and you're going to lose track of what you're really doing. I used 3 resources when I was studying for my boards. Even though they had suggested for me to take the boards about 6 weeks after I graduated, I actually took it about 4 months after. I scheduled my appointment in March to take it in June. And I did that last year. And every week I had my planner. Every week I did a section. Every week I did a full loaded exam for the 6 weeks that I did it, 6 to 8 weeks that I was planning out everything. So there was no wiggle room. I didn't go out to eat dinner when everybody was, I felt that if I pushed on either end of the railroad, I would lose sight of what my goal was. So I allowed myself that, but it's not an easy road. However, it is totally doable. I went to school full time and I worked full time. It is totally doable.
Mm-hmm.
I agree 100%. The way I completed my family nurse practitioner, I completed that at FDU. I was already a professor. I went to the program at Columbia University, had a program where you could go from your bachelor's directly to PhD. So I qualified for that program. I completed my PhD and started teaching at FDU. And I realized I don't have a master's. I don't have a master's. So I was teaching at FDU, and I'm teaching most of the master's level program, right? And I was like, oh, let me do a master's. So I did a master's degree. They took many of the credits because I already had a PhD. So to me, I was very lucky. So I only had to do the clinical courses, the health assessment, the pathophysiology, psychopharmacology, all of the clinical courses that I had to do. I didn't have to do a dissertation. I didn't have to do capstone project. I saved a lot in saving the credits. And then I became a family nurse practitioner and I became board certified, by CCNE. And I actually took it right away just because I happen to know the statistics. If you don't take it right away, you forget 70% of what you studied. So I was like, either I pass or I fail, but let me just take the plunge. And I did. And luckily I passed. And so family nurse practitioner, started working once a week per diem in the pediatric area. Even though I became a family nurse practitioner and I took internal medicine and I took women's health, I decided to focus on pediatrics because you know what? When you take one focus to do well, it's more satisfying, in my opinion, than doing everything and not being good at one thing. So that's how it happened for me.
Okay, thank you. Welcome, Nurse Abankwa. Thank you for joining us. I know you.
Thank you. Thank you for having me.
You're welcome. So I'm going to have to get you caught up with everything we've been discussing so far. So you're going to be in the spotlight for a few minutes. So can you share with us if nursing was your first career choice? And if not, what did you want to do initially?
Oh, yeah, sure. Can you hear me okay?
Yes.
Okay. So I actually, when I first entered college for my undergrad, I was a psychology major. And then, I really thought about things and I looked at the rigor of the courses and the long-term goals. And I realized that I would really need to have a master's degree in that in order to really, really establish myself. And I had to reevaluate what my primary goal was, which was to help people. And I felt like nursing would offer me less of a limitation in that I'd be able to, take care of the mental health of the client, but also physically as well. And so I switched over to nursing after talking to my mom because she was, a major factor in my my change of major. So and then it was all she wrote after that. I did my 4 years, a bachelor's at a historically Black college university, Delaware State University. And then I went on into the nursing field, and I worked for quite some time. I graduated in 2005, and I didn't enter into nurse practitioner school until 2012. So, yeah.
So, can you share some of your challenging courses or any courses that you did well while you were in school?
Oh, I can share. I felt like I'll talk about undergrad first, and then I'll talk about my master's preparation. I felt like I just had a complete culture shock when I got into college, in general, because in high school, I was used to reading maybe one chapter that had maybe 14 font and maybe answer 4 or 5 questions at the end of the chapter, and that was it. But when I got to college, it was a whole different show. I had to read chapters upon chapters, and they were small font, guys. And anatomy and physiology really whooped my butt. I mean, I remember my first test score, or my first 2 test scores, they were not passing, and I'm not ashamed to say that. And I feel like, there's others that probably had a similar experience, and it was really discouraging. It was very discouraging. And thank God for the upperclassmen, because I reached out to one of them and they offered to tutor me. And that is how I made it. I mean, the one woman that tutored me, she was really sharp. And so she just broke it down, and she made it so simple. And so that was my biggest challenge. And she taught me how to skim through chapters, not read them completely, how to focus on keywords and all these things. And I felt like that kind of equipped me for my master's. So when I got into college for my master's, it was definitely more challenging, because now I have a family, I have a spouse, I'm working. So I have my job full time that I have to kind of juggle with family and everything, but I would say in college, in my master's level, the challenging courses were, there were just so many of them. It was so long ago. But the major thing, I chimed in when our pediatric nurse practitioner was speaking. She said you just have to narrow it down and really be focused, and that's what helped me a lot. Also, being a little bit sociable and speaking to my peers, getting their phone numbers, putting together study groups, exchanging notes, that helped me a great deal. And then also, you need that work-life school balance, So I had to have a talk with my spouse, because he wants to eat when he wants to eat. And he still expects the house to be, pristine, and I gotta fit that in with the kids and everything, So he understood that things are not going to be the way they were, because I have a lot more responsibility, So for me, I think it was definitely more challenging in my true adulthood as a mom and everything, trying to juggle the responsibility. So one thing that I did is I changed my status at work from full-time to per diem. And even though I still picked up full-time hours, it gave me more flexibility in my schedule, because I still had to make time for clinicals and these things. And I didn't want to be fighting with my manager for time off, so that helped me a great deal. And then also, I believe in test prep courses as opposed to just self-study, you see, because taking a standardized exam is not just knowledge. There's a technique involved, and having that mentor or your instructor, they're going to teach you strategies, and you're able to ask questions and really understand where you went wrong and where you could improve. So I tell my daughter, she's getting ready to graduate high school now. I made sure that she took a test prep course, and I saw a difference, But I did numerous study guides, answered millions, thousands and millions of questions. And I remember, and you can stop me at any time because I do have the gift of gab.
It's all good.
Okay. I remember taking my NCLEX as an RN, and I was very nervous. And I remember, my test prep instructor, because I took the Kaplan test prep, mentioning how the test was structured. And she said, you can get the minimum amount of questions, or it can go all the way to this. And I remember question number 75. And I sat there, I feel like I sat there for half an hour because I was determined. I was just determined not to get it wrong. And I was so nervous, and I answered the question and the screen shut off, and I was just so nervous. And I thought I failed, but I didn't, So statistically, it is true that you should take the test as soon as possible. Now, I graduated from Rutgers with my master's, and I was feeling a little bit more overwhelmed. So I took my NCLEX for RN maybe about 6 weeks after graduation. But for my master's, I graduated in May. And let me tell you, I rescheduled that exam date. So it was maybe early. It was 3 months after graduation that I had it scheduled. And I just felt like my studying wasn't up to par. And I rescheduled it maybe another 2 weeks out, but I didn't have the test prep in my master's. So I was really doing a lot of self-study, and I had planned out a schedule for myself so that I could dedicate time to just focusing on that. So if you're dealing with all of the responsibilities, just make sure that you carve out time specifically for your education, because it's very much necessary if you want to be successful.
No, absolutely. I remember too, I think when I finished nursing school in 94, I think we were like the second group of people who were taking it online. So I remember that it shut off at 75 questions, and I'm like, okay, what does that mean? Did I pass or did I not? So like years back, I think Dr. Vargas, you probably took the paper and pencil test probably, right?
I did. I had to go to Atlantic City, stayed in a hotel.
Oh my goodness.
It was one of the new Trump hotels. And we actually stayed there for the entire weekend, took the test, and we had a lot of fun after the test. We went to the casinos, we started playing. But long story short, the first time I was supposed to take the test, someone in, I don't remember what part of the country, stole a test. And so they canceled that test taking for the entire country. This was back in 88. And so they rescheduled that exam. I forget how long they rescheduled, so it gave me more time to study. But the second time, that's when we stayed at the hotel, and it was actually a lot of fun. And yeah, how did I prepare? I took Kaplan. I answered a lot of questions. I purchased textbooks that had questionnaires about the NCLEX and answered questions. I think I must have answered like 500 questions. And it really helped me a lot, because when I was answering the questions, paper and pencil through the exam, many of those questions were kind of similar to the ones I had practiced on my own.
Yeah, I was thankful. Holy Name, definitely, they prepared us that second year. I think it was like maybe 1,000 questions or something that you had to do by the end of the year. So every week you had to do questions. I did not do a review course, but I remember Lippincott was one of the study books that I had, and there was another review book that I used just to help prepare for it. Because I think I finished in June. I took my boards in August. Actually, I interviewed for a job even before I knew I had passed, but I guess God was looking out for me because I passed and started working. So let's talk about clinical, if you ladies want to want to share about your clinical time. Like, how many hours did you spend on the nursing unit? I know for us at Holy Name, the first year you spent 2 days, 4 hours each, and then our second year it was 2 days, but you were on for a full like 7-hour shift with 2 patients. So if you want to share what your clinicals look like, your time.
So,
Go ahead.
So, so again, I attended Bergen Community College for my nursing degree, and and again, I was working full time, had my son. I was a single parent at the time, juggling 20 million things. And so my schedule was super tight when it came to clinicals, but I did my clinicals I juggled between Valley Hospital and Hackensack Hospital. And the way Bergen Community did it, you had days that you had to either do it or evening shifts. So there was some days I worked at Tenafly Pediatrics, and I would have them give me a schedule from 8 to 12. And then from 1 to 9, I'm in the hospital doing clinicals. And I did that for many days during the week. Or I would choose to do the Saturday where I would make sure that I'm off, and I would do my clinicals from 7 to 5 p.m. Basically, I had no wiggle room in my 24-hour day at all. Every minute, every second was accounted for when I was in nursing school. I had no time to be sick. I had no time to be late. I had no time to oversleep with the alarm. Every single minute I had no wiggle room, and it was intense, but I'm super organized. So it worked for me. Many people would not have been able to do it. It worked for me. So that was for my nursing degree. When I came for my graduate, for my nurse practitioner clinicals, that was in the middle of COVID. That was a little difficult because not a lot of places down in Georgia were taking any students. And so I became a little resourceful, and I went back to Tenafly Pediatrics in New Jersey. So I would fly from Georgia to New Jersey. In 1 year, I flew about 6 times. And in the 6 times, I stayed about 2 weeks at a clip. And in those 2 weeks, I did about 100 hours. Again, my time was crunched. I had no wiggle room I came up for some oxygen, and that was it. Nothing else. I had no time to get sick. I had no time for a flight to be delayed. I went straight from the airport one day with my suitcase in hand to the office in Clifton. I was already dressed in scrubs, and I banged it out. And there were some days I was there for 10 hours a day.
Wow. Okay. Thank God for connections. Mm-hmm.
And my parents living in New Jersey and my son. So I had access to a car. Mm-hmm. I had access to a place to stay. But if it wasn't for Tenafly Pediatrics, it would have been very, very difficult for me to complete my clinicals.
Wow. Okay. Anybody else want to jump in on clinicals and how that was?
Yes, I like to. Wow, Lisa, congratulations. Amazing what you did. So anyway, the clinicals for me, when I went to Bergen Community College, I rotated through Hackensack, I rotated through Valley Hospital. I did all the rotations. I would go to school full time, and I would work in the evenings. So I had the day to do my rotation. So that wasn't bad. When I did my RN to BSN at FDU, we did community clinicals, and we did the same. I worked in the evenings. I was able to work in the evenings, and I was able to go to school full time during the day. So that's how I manage. With the nurse practitioner program, connections are so important. It's very important to keep relationships with members of the community, with your classmates. Your classmates become your connections, because remember, they're going to go to work someplace, and you might need to go to that place one day. So I always kept connections, and I reached out to North Hudson Community Action. I had my friend Gina, her husband, a lawyer, was in the administration at that institution. So I reached out to them and I told them I wanted to have women's health rotation and pediatric rotation, and that's how I got in there to be able to do my clinical hours. So the same, working full time, not having time to do anything. My brothers on the weekends will call me and say, "Come over, we're having a party." I'm like, "Enjoy it. I'm gonna see you later." Or in the evenings, "Hey, we're coming to your house," or they would show up and I'll be like, "Sorry, I'm studying, I'm doing something, I'm writing a paper." So, my family took it hard for many, many years, but definitely worth the time, worth the effort.
Mm-hmm. Yeah, I remember my clinicals also, we did most of them at Holy Name, but our pediatrics, we went to a hospital in Newark. It doesn't even exist anymore. United Hospital. We did psych at what used to be called Bergen Pines here in Bergen County. So you were kind of all over the place with Holy Name. Any of you other two ladies want to jump in on clinical and how you manage that?
Yeah, I can just add about my clinical experience. So with Rutgers, a lot of it was based on classroom learning, of course, but we did have the opportunity once a week, I would say around 8 hours each day, to go to clinicals, whether that be for the med surge or for OB. But based on what Dr. Vargas stated, it is about making those connections when you're at clinical. So for me, because I was only there once a week, I did have to utilize my time wisely, whether it be connecting with other nurses, learning about how they chose their specialty, and also connecting with the nurse managers on the unit to see, is this a place I want to work at? And it gives you the opportunity to just explore, the hospital to see if this is a hospital you would stay at as a new nurse.
And for me, I would say besides the mean nursing instructors that I had in my BSN program, it was driving. So I was out of state and the hospitals were spread far apart, so I had to drive quite some time, maybe about an hour or an hour plus to get to a good one. And also, one of the challenges that I found in my nurse practitioner prep is finding a doctor, that was willing to take me into their practice, or even another nurse practitioner. I didn't end up finding nurse practitioners, so I followed physicians. So there was a little bit of a limited pool of individuals that were willing to precept me. So I think that's something to start looking into it now if you know that you're going to go that route, because networking is really, really important, and like our professor was saying, start to network and talk to people and make connections so that in the future you'll have a resource.
No, definitely, that makes sense. When you mentioned the nursing instructors, I remember this one we had. Her name was Olga Kristanovich. Nurse Kristanovich she was so old. I mean, she used to tell a story that she might have been there, like helping, free some of the people who were in the concentration camps. Were like, really, Nurse Kristanovich? But let me tell you, her as an instructor, to this day, if I'm visiting someone, I'm looking at the IV tubing, because she would say, make sure that there are no bubbles in the tubing so you don't kill the patient. So you don't want me in a patient's room. I'm like, you didn't have Nurse Kristanovich at all as your clinical person, because there's too many bubbles in that IV fluid. But, those are the things that I learn and remember from clinicals. Like I said, it would be pretty intense when we had to do your nursing care plans, and you had to come in with the medication list and remember all the side effects and any interactions they had. But I think those were like great times, though, having those the pre-round talks and then post discussions with the classmates. So I think that was helpful in creating that support system, which later on you can go back to in case you're looking for a position or whatever. So I think that's definitely helpful. So I know that we have a couple questions from the Q&A. The first one is asking about COVID. How did it impact you professionally? I know some of you hadn't even been practicing nursing yet, but if we could talk about nursing for those of us who were nurses during that time, and then we'll add the other ladies in who were maybe just studying or whichever.
So with me, I was working a lot at North Hudson in pediatrics because FDU closed its doors probably around March 15. We closed, we didn't come to campus, we're working through Zoom. All of us were new at Zoom, we're learning Zoom, we're having the classes remotely. This was a brand new world. However, the practice, the pediatric practice was still open, and we're still seeing kids, and they were coming, with COVID. We were afraid, but it did not impact me professionally. If anything, I became more aware of, wearing the PPE, protection, washing my hands, keeping the distance, keeping all this stuff that we needed to learn as we went along, because this was a brand new world, something very unknown. It impacted my family greatly. I lost a few members of my family to COVID. So to me, it was, personally was traumatic. Professionally, it didn't impact me professionally at all.
Okay. Anyone else?
For me, there was a huge impact. At that time, I was running my own practice. So that was a really huge challenge for me in that I was sort of stepping into the unknown, and now I had to invest in some, great PPE. And sometimes some clients would cancel because they also didn't know what I would bring into their homes because I was a house call provider. And then the blessing came when there was a mandate that we could bill for telehealth. This is when telehealth really became trendy, popular, and useful, and it allowed me to now do remote visits where I wasn't doing that before. And it really opened up more doors for me. Unfortunately, I did lose a few clients during that time, but thankfully, I never contracted it. Well, I did not contract it during the initial onset of everything. Later, that came. So looking at everything in retrospect, I would say it was challenging. It was very challenging and scary.
For me as a school nurse, we shut down, so there really wasn't much to do. Like students weren't calling us at home to say have a stomach ache or whatever. So myself and at least one or two of the other nurses, we worked with the health department helping do contact tracing for some of the people in town who were positive. So that's kind of like how I felt that I was contributing somehow, because I was not at the bedside, and we know how hard it was for the nurses who were at the bedside during that time, coming home and not really being able to hug your family or your kids because you didn't know what you could be bringing home to them. So, that was a tough time.
Mm-hmm.
Elisa, Nurse Vialva, you mentioned how it was with your with studying, and Pearson, you also were studying during COVID too, yes? A little bit, or no, or was it afterwards?
Yes, I actually was going to add in that I started working in healthcare the year before COVID. So I would say seeing that transition between the emergency room going from maskless to completely masked, and as we were discussing the PPE, it was definitely alarming. But all in all, I feel like it made me a more caring healthcare worker. It gave me a lot of amazing experience, and I was studying virtually at that time. We went from beginning my prerequisite courses, the anatomy and physiology, the chemistry in person, to completely on lockdown. So while the remote learning did give me the opportunity to work in the emergency room and also study online, it did take a toll, seeing obviously losing, different patients, seeing a lot of staff transition out of the hospital. I feel if I can get through that, that's what really kind of solidified that nursing was for me. So it was a challenging time, but overall a fulfilling experience healthcare wise.
Mm-hmm. There's Vialva. You wanted to add something also?
So I think it was almost challenging because at the time when COVID was happening, I was working in pediatric cardiology. So now we had to maneuver. We're seeing patients from a few days old, whether they're pre-surgery, post-surgery, through the gamut. And it reached the point. Plus, I was also in grad school, so trying to complete clinicals. And what we found is originally they all had us remote. There were some people they kind of downsized a little bit, but not to the extent that it was impactful. However, it was impactful in the sense that when we came back, the issue became of how are we dealing with MISC, which is the multi-system inflammatory syndrome that came about as a direct result of COVID. And this was very new to everyone. However, it impacted cardiology because now many of the cardiologists, pediatric cardiologists, they're also professors at Emory. They all had to collaborate to come up with how are we going to treat these patients? And no one knew at all how we were going to do it, what they were going to do, the steps. They had to create an algorithm of what to do, how long we're doing it, when do we see them in cardiology. So that was very, very impactful to the cardiologists that I worked with, but including professionally, because we had additional questions that we had to ask, because now half of them were on aspirin. Some of them were discharged still on steroids. So we had to also be mindful off of that. And there was some that actually developed heart disease as a result of this MISC that was directly related to COVID. So I think in all realms, I think at some point in time, there was impact felt on every level.
Absolutely. And I think we're still not done seeing the effects of it at all. But hopefully, we'll try to do better in some ways in order to help the children and the families who are still dealing with all the repercussions of it. So let's talk if there's any more advice that we can give students who are thinking of going into nursing school or who got accepted into a BSN program or still working on prerequisites. What other advice can you share with the students on how to make it through?
So
go ahead.
Go ahead, Dr. Vargas. Go ahead,
Thank
Dr.
you.
Vargas.
So I would say focus, make sure you know where to go, where to find the information, and just go get it. Don't let anything else get in the way. Don't lose sight of your goal, and go every day, small steps. It's not reaching the goal right now. It's the process to get there. It's the step that you take every day to go and to get that goal at the end of the day. That's where it counts, what you do every single day. So every single day, get up and do at least one thing towards that goal.
Okay.
Springing off from what Dr. Vargas said, she's right. You have to do something every single day. Stay focused in what you're doing. And I remember one of the professors, and we were all joking about it when she mentioned it to us in Bergen Community College. She's like, you are about to start nursing school and you're going to have to put your family on the shelf. She was not kidding. It's as we were laughing about it, but when we were neck deep into it, they were not kidding. We were grasping at straws at the end. But let me give another twist to the nursing. I want to be a little transparent and make myself a little vulnerable for 2 seconds. I failed my nursing boards the first time. So I want to put it out there so people know that I'm sitting up here as a nurse practitioner. I failed my nursing boards the first time. I was devastated, completely devastated. I had a pity party for about 3 months until my mother said, "What am I doing?" And that's when I took the Kaplan course. And when I took the Kaplan course, as has been spoken, they show you how to answer the questions. That's basically what they do. And with that, I took it. I was super focused, super vigilant. I took my exam. I will never forget. I took my exam on a Wednesday. I took the entire week off. I used my vacation time and took the entire week off. And only one person knew the date of my exam this time around. I told no one, but you have to be super vigilant because the first time I took that nursing board exam, it gave me all 265 questions. And on 264, they say, because it's computer adaptive, if your last question is at a passing level, whether you get it right or wrong, you pass. If it's below, you will fail. And as soon as I saw that question, I knew I failed. I was devastated. But I make myself vulnerable to say that it is not easy. And I'm sitting up here telling you, I failed my boards the first time. I didn't fail it the second time, but I fail it. So there are times you're going to stumble and you're going to fall. But as Dr. Vargas says, keep going at it. You will get there. This is what you're destined to do. You will get there. Be patient, keep at it, and have a good support system and a circle around you.
Thank you. Thank you for sharing that. Anyone else?
I would like to chime in on this one. I love MP Vialva. I hope I say that correctly. Her story. She is a very determined woman, from what I'm hearing, and it's just so inspiring and impressive. So that is the number one foundation that you need to have, is the spirit of perseverance, when you get into nursing. And nursing is highly stressful, believe it or not. There is an easy way to do things and then a hard way to do things. And my advice is, if you are gifted with the opportunity to go to school right away, I mean, right out of high school, you don't have any responsibilities or anything, don't delay. Just go, get it out of the way. It will provide you more peace of mind, less stress, more room to focus and do the needful, and it will come with ease. But if you enter into school and you have so many circumstances and so many situations, it can still be done, guys. And that's where determination comes in. For me, I really do cherish making space for things, because I've spoken to so many friends and colleagues. I have friends who are pregnant and who are delivering babies, and then the next day going to school, and you have so much on your plate, and the key to me is just to carve out space. Be gentle with yourself. Give yourself room for this particular program, because it's an investment, and you want to make sure that you're setting yourself up to succeed and not to fail. Okay. And also, I do believe that you should armor yourself with the ability to tap into the different senses. So, for instance, you want to be able to feel things when you're learning. You want to be able to use that visual, audio learning. So if you're going to lecture, record some of the lectures if you have the ability to, and then go back and listen to it while you're driving. You want to be able to write notes. Now with all of this online, I noticed that sometimes it's hard to stay focused and to retain information. And I think that the old school methods really do work. So going back to a traditional pen and paper, write down your notes in your notebook, and you'll notice that your brain is retaining more, information. So it gives you more capacity to remember the details, and practice very, very much. Practice a lot because practice makes perfect. Okay, so that's what I can say.
Thank you. Nurse Pearson, you want to jump in?
Yes, definitely. What amazing advice you all had to provide. I would love to just add that just never give up, no matter if whether you fail a class, you fail an exam. I too am a nurse who has failed. I actually failed health assessment. And when you fail a course within a particular program, they may make you wait, they may let you move on. I was someone who had to wait 6 months. I studied, and I passed. And here I am today sitting as a neonatal nurse. So that's probably the biggest piece of advice, to not give up, to use something as motivation to push you, and to realize that, if you want to be a nurse, you will be a nurse. And I also want to add in that there are sacrifices. I love that the term of putting your family on a shelf. While it may be hard at first, you do have to make those sacrifices, not just with family, but with friends. A lot of people may not understand at the beginning, but this is something that requires your entire attention. So just realize and remember when you are studying that everything is temporary. Everything that you are sacrificing and putting to the side will eventually come back around once you're a nurse, and it'll be that much more fulfilling when you have your degree.
Yes, thank you so much for sharing that information. I'm hoping the students who are listening are taking notes on what we all have said, because if that's what you want to do, you have to put in the time and the work for it. There was another question from the audience about how much experience a nurse should have before pursuing becoming a nurse practitioner. So what do our NPs want to say about that?
So I would say, as coming from an educator background, there's different schools of thought on this subject. Some people think that you can continue straight from your BSN. Many people who are going to into their masters, they're already working, whether they're working full time, part time, per diem, they are already in the workforce. So if that is the situation for you, I would say continue. There's no reason why you should stop and do 1 or 2 years of medical surgical in a hospital before you continue to your master's and your MP education. Because if you already have in your background experience as a nursing assistant, as an MA, as a nurse, all of that will come into play. The key here is to keep active, to involve yourself in some type of practice, whether it's per diem, part-time, anything to keep up the skills and to have that background. It will make it easier. However, if you do stop and you go and work in a medical surgical unit or a hospital or any other setting for 1 or 2 years, definitely when you come back for that master's, it might be a little easier for you because you already have, some of that background information, how to treat a patient, how to approach a patient, all of that. So I would say it's different for everyone. And I think you will know in your heart what you can do and what you cannot do. And give it a try, because many people get used to that work and never go back to school, or they end up working and getting used to that paycheck and getting used to that time off in the evenings, that time off in the weekends, and not going back to school. So I always recommended people to just continue if that's what they want, if they have an ultimate goal that they want to reach, and they can continue straight from their bachelor's. Why not? And I think that's coming with a bias because I'm an educator, I'm a professor. So yeah, I'll stop here and let you take that on.
So Dr. Vargas is right. It really, really does depend. However, when I started out as a medical assistant for 13 years, and I went back to school, got my associates in nursing. However, my job stayed almost the same. the pay increased. And the one addition to my job was I was able to triage messages for physicians. Outside of that, I worked alongside physicians when I worked at Tenafly Pediatrics. So my credentials on my end changed. I still worked alongside or assigned whatever physician I did every single day. However, I was exposed for almost 16 years and I worked alongside physicians. And as I tell a lot of people, we learn textbook stuff, but there is nothing more valuable as to when you're listening to when the doctors are sitting, consulting, speaking with a patient, and you just listen because it's totally different. Textbook tells you one thing. You're learning the basics with your textbook. But when it comes to dealing with patients, the biggest thing is exposure for me, listening to patients, because I was a brand new nurse. But majority of my years was as a medical assistant, but I knew I wanted to further my education. So with that being said, I positioned myself appropriately and accordingly to allow myself to learn more and to educate myself and ask questions when I heard the doctors talking. Again, I was an MA, a new nurse. So when I'm saying, hey, in the room, I heard your thought process. What made you come up with that? So my thoughts were already there from jump, because coming into this country as an immigrant, I already knew from jump what I wanted to do. There was no deviation. And I put myself and I positioned myself appropriately. You have to pivot your way through life occasionally, but positioning is very, very, very important. As Dr. Vargas said, you will know when the time is to just either go through straight or if you need experience.
Really, really good comments. I agree. I think that, it depends. And what I'll say is, I don't want to sound too strong, but I do think that there should be a time frame I would say about 2 years. And the reason why I say that is because I remember this really funny situation as a nurse on the unit. A nurse practitioner was rounding on this day, and this particular patient had a situation, and the nurse came to us in, that nursing circle where the nurses all sit down, and was asking for advice on how to treat the patient. And he was presenting as someone who wasn't well experienced and maybe didn't know what to do. Now, we have so many struggles as nurse practitioners to achieve autonomy in this practice because there's politics involved, and some like to say that we're not competent, we're not capable of providing safe care, and so on and so forth. So our reputation is very important, and I think that we should be careful and make sure that we have enough exposure and enough hands-on before we venture into advanced techniques and knowledge and practice. And so that's why I want to advocate for having some sort of hands-on experience as a registered nurse or as a nurse before you move on to advance your degree. And I think that should be at all levels because textbook knowledge, like MP Lisa said, is different from hands-on. And when you do the hands-on, you're actually able to connect the dots and things become so much clearer to you, and you're able to to make better decisions. And, we are in a profession where we are here to preserve humanity, and we want to make sure that we're out there. And if we're the solo provider, if we're the sole provider of this individual, we are making accurate diagnoses, and really saving lives.
No, I agree. Thank you. Thank you for sharing that. We have a two-part question asking what factors should be considered when selecting an undergraduate nursing program, and does school ranking matter? Anybody can jump in on that.
For me, I'll just say I don't think school ranking matters. No one really asked me for my GPA, my honors GPA, when I was going to get a job. So for me, it's all about how you perform, and it's like that with every profession you go into. People can have all these accolades, but when it really boils down to it, who is going to save my life? So.
Mm-hmm.
I would just like to add some factors, definitely financial, as far as if you're taking out student loans or going through FAFSA, if you have the opportunity to have grants. I know if for myself working on my second degree, I did utilize a lot of my loans and grants for my first degree in psychology. So that was something that I did have to think about. You are going to potentially have to apply for those loans. So I would say maybe consider a school that has scholarships, grants, if that's a factor, and also commute-wise, having something I can drive to that's local were two things that I feel are really important that I considered.
Anyone
I agree.
else?
I agree with both of you. Everything you said. I don't think rankings matter. Sometimes you go to school and you realize what a hidden jewel. Like, wow, I'm learning so much, and this is amazing, and it doesn't have the rankings that another school may have. And you may even have a better experience because the classes are smaller, or the professors have better relationships with the students. So this is another case where it depends. It also depends on your finances. Can you afford to go to a university? Personally, when I started my education, I could not afford. I had to work full time to pay my own education. So I chose the community college. Would I had the money? I would have probably gone to a 4-year degree. So it's definitely another thing, that you have to think about, and it depends a lot of the times on your finances, your family situation, your support system, all of that.
So I definitely agree. Finances for me, it was, as Dr. Vargas said, it sounds as if her and I had a similar journey. Couldn't afford a 4-year school. Finances was important. It was the first and foremost. I had to work full time. There was no ifs, ands, and buts. So I waited patiently for almost 13 years until Bergen County Community College opened up their evening program.
Wow.
And that way I went from school, leaving work at 5:30, getting to Bergen Community College for school to start at 6:05, 6:10, something like that. So for that reason, when I did that, and then I moved to undergraduate, I did that online, and I went to Southern New Hampshire University. And again, that was mainly a financial decision, because when I was looking some other schools, financially per credit, it made sense. I was able to work and pay out of pocket for it. And I did that. I think I'm going to be a little biased. School ranking, I actually did look at it when I was choosing my graduate school. Only because I felt if I'm going for a nurse practitioner, many places, they actually do look at the graduate schools that you go to. And so I searched. I would actually wanted to apply to Yale and Duke. I had the credentials for it, but I did not have the money for it. So I chose UAB. Financially, I was able to pay for it out of pocket. It's ranked in the top 15th for a master's program, right alongside Yale. I'm like, it's a win-win situation. UAB was phenomenal. So school ranking did play a part for my graduate choice. For undergrad, the one other thing I would say is we have to be realistic that places that you're looking to put your resume in, they do look at your school. They look at your resume. So in addition to doing your undergraduate nursing program, my one other recommendation is do a volunteer in the community. It goes a long way, especially if you went to a college that no one knows about. However, when they see a lot of community service, you did a lot for the community, you did a lot of extracurricular activities, that actually goes a long way. When I'm looking at a resume, you're looking at a resume. Let's just say you went to a school and they're like, where is this school? What is this school? But when they go down and they see, wow, look what she does in the community, that is what's going to tug at me.
Okay, well, thank you so much for sharing all that information, ladies. I don't even know what to say, but I'm hoping that everybody they got a lot of information from us this evening and were able to get a feel for what nursing is like. You've heard from 4 different women who have totally, some had similar starts and then some were different, but ultimately we've all ended up in a place where we want to be doing something that we love so much and would do again if given the opportunity. So I want to thank you all for taking some time this evening to share with the NAAHP family. And on behalf of our partners, I want to thank each one of you for coming and just sharing about nursing careers more than just bedside. So thank you everyone for joining us, and we will see you on the next broadcast. Have a great night.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye-bye.